get the youths, and we're going to focus more on the youth and the adolescents. So get ready, we are going to start. I'm going to begin with our very own Dr. Joyce. You're going to tell us what is substance abuse. We're going to discuss. Tell us, what do you know about it?
Thank you. So when we talk about substances, we are referring to things like alcohol. We are thinking about drugs like marijuana. People go to use glue. Others use perspiram. So there are these things that people use to change the way they feel, or to take away their worries, or just to, like things like alcohol. Alcohol is a social drink, yeah, to socialize. So there are various reasons, but there are so many substances that people use. Now, when we talk about substance abuse, this drug is causing you problems, but you continue taking it, yeah? Probably you have a physical illness, or you cannot look after your family, or you cannot do your studies, concentrate, but still you keep taking that substance. So in a nutshell, that is substance abuse.
Okay, thank you very much. Thank you for that great summary. Let me go again to Rebecca. I believe you also know something about substance abuse. Share with us, what's this all about? What can you add on that?
Thank you so much. With this pandemic of COVID, it is now a need to talk about it, because people are abusing drugs. Because of the depression, because of what they are going through, they are failing to get that, to supply their basic needs. People are resorting to this. And our youths are at home, they are not at school, they are being forced to be persuaded by their friends to start substance abuse. And unfortunately, most of our youth don't know that they are being induced into this kind of business. That's why it is so important at this moment to talk about it.
Thank you very much, Rebecca. Now that you're saying the times we are in are the real times to talk about these things. Dr. Joyce, now, Rebecca has triggered my mind to really think of something. COVID and substance abuse, how can we marry the two? How can we relate the two? And also, by the way, do these things really happen in church, or we are just talking things that are not existent? Tell us something around that.
Okay. I'm happy that we are talking about this issue of substance abuse. Actually, substance abuse is a global public health concern, because, as you know, people are dying, yeah? People are dying, people are being stressed. At this time of COVID, the COVID pandemic itself is a stressor. Students used to be at school and being occupied. So like we are going to see, I think I'll talk about why are they overtaking substances, yeah? People who have been taking substances before COVID, it has been documented that they are even increasing, yeah, their rates of taking substances. Why? People are redundant. People who used to work, people who used to study, they are not working. But in addition, the stress that has come as a result of COVID, people who are working, people who are, earning a living, they have been so frustrated. People have lost jobs, and some people take it as a way of relieving stress, like I said. Our brains were created in such a way that there is a part that is dealing with reasoning, thinking, feeling, judgment, yeah? But there is also a part that is concerned with pleasure, yeah? So there are chemicals in the brain which help us to feel happy, to enjoy, yeah? But there are also areas, like I'm saying, in the brain that are helping us to think and reason. Now, when we use a substance and the brain perceives it as a good thing, you are not sleeping, now you are able to sleep. You get that pleasure. The chemicals which regulate pleasure may be released in excess, that you are not able now to judge, yeah, to make the right judgment, yeah, or to think, yeah, constructively. That's why people who use substances, they are going to take like impulsive decisions. You act before you actually think about that act, what you are going to do. What are the results of what you are going to do? Yeah, you are thinking in the now. You have a problem, but when you take a substance, it is telling you that, oh, there was this problem, now I'm sleeping, I'm not thinking about it. Or I had to read hard, but now you know, your brain perceives it as if you've already passed the exam before you don't even need to read. So these things happen. It does not, it cuts across, irrespective of whether young people are in church or outside church. It happens. The problem is real, yeah? So I wanted to bring in that chemical bit, because later we shall talk about the treatment. Yeah, do they need treatment? So this COVID, with the stressors it has brought, it has increased the rates of substance abuse. Yeah, and it's a problem. It's a public health concern. When someone is driving, you know, you can leave your car there, and your child can impulsively just get it and drive, and many get involved in accidents, especially when they are under influence of alcohol or these other substances. So it's very important that we talk about it even here in church. The problem is real.
Thank you very much. Now, this brings me to Rebecca on the same point. COVID and substance abuse.
Yes, thank you so much. I want to share with our viewer and listener that a research was done here in Uganda in our schools to find out how the problem is in schools. Unfortunately, all our schools, they are drugs. They are using these drugs. They are abusing these drugs. So that means it's a problem which is affecting all of us. Whether Christian, whether non-Christian, whether what, it's affecting our youth. So it is important to talk about it.
Indeed.
COVID has caused problems, as Dr. has said. You know, people used to be in a hurry, like they were being occupied. Now our youth are free. They are at home.
Indeed.
They are using these smartphones. They are accessing internet. They can share anything. And unfortunately, this is an addictive substance.
Yes.
When you start in small doses, you'll just find yourself adding on. You feel the pleasure of adding it, and the way you feel good. But then the effects. That's why you have to talk about it now. For someone who is listening, it's a real problem,
Indeed.
which is with us.
Indeed. Thank you very much. I know some students who are at home and during school time, and he has an exam tomorrow, he has to take some Panadol or something to keep him awake or to release the pain of the headache and what, so that he can read up to 3 a.m. and has an exam the following morning. These are the things we are talking about now. I've preempted
Actually, you've talked about paracetamol, and I've remembered that, you know, when we talk about substances, it's not only the illicit drugs.
Yes.
Some are over the counter, like prescription drugs, but no one has prescribed them for you. But because you are feeling you cannot sleep, you are going to buy yourself diazepam, you are going to buy yourself a 10 because you want to feel that high. You are going to buy so many drugs. So some of the substances people use are actually over the counter, sold over the counter. And it's unfortunate that in our country some people can access these substances, even the serious ones. So it's not good.
Indeed.
Yeah.
Thank you very much. So those things that you use, like, I cannot sleep. If I don't take Panadol, no, I cannot get sleep. If I don't take this and this drug, I don't feel fine. Just know you're abusing those substances that we are talking about. Now, we've gone a little ahead to talk about now why. I know we've already talked about now the other issues, but Dr. Joyce, why do you think, what causes the youth, what causes the adolescents to go into substance abuse? What's the problem you can share with us? What could have gone wrong for them to start abusing the drugs or the substances?
Some of them, it is peer influence. And you know, we have the marketing, advertisement of some of these substances. Like you can imagine someone especially alcohol, I think is more advertised.
Yes.
You get a glass and then you are pouring in that, unique way, and the young person sees it as a good drink. Let me try. But as I told you, there are chemicals in the brain. You try, but if it gives you that pleasure, you are likely to continue taking. You can imagine on the cigarette pack, there is written a word. You know what is written there?
Yes.
And there is a drawing of a skull.
Yes.
Yeah? So one would be scared
To even
of touching it because it is very indicated. And on almost all alcoholic beverages, it is indicated
Yes,
not
it
to be
is.
taken by people below
this
age,
age,
18 years. Yeah? But why are people continuing to take? We talked about this issue of addiction.
Yes.
These are, I use the term psychoactive substances,
Yes.
meaning when they reach the brain, they can cause addiction.
Okay.
That word addiction is also a little bit complicated, but I think
you want
it's,
to take it more.
More.
You want to
You want
take
more
when
of
you
it.
start it.
Yes.
You feel like you want to take it again.
you
Okay.
cannot control yourself.
That is it.
Yeah, you cannot control yourself. You say, I'm going to drink only one bottle,
It will
maybe
be enough.
one glass.
Okay.
But when you reach the place, you
Take another one.
you take more and more,
That
and
is
people can take up to a crate.
Yes.
Yeah?
When they started with one,
They started
Yes.
with one.
Okay.
So these substances affect the brain and they are addictive. Yeah? But there is one thing that I wanted to mention. So people are taking because others are taking.
them.
They might be taking because they want to fit in. I want to be like my colleagues. I want to be like them. But also, majority of people who take these substances, they have challenges.
Yes.
Like I said, I talked about stress. Many people have pain. People are abused.
yes,
Yeah? They have emotional pain. People are depressed. When you are depressed, you don't feel good, you don't feel happy. Not only for one day, but for 2 or more weeks. You are feeling bad. You have lost interest in things which you used to enjoy. You cannot sleep. You don't enjoy food. You cannot concentrate. And when a colleague says, no, you try this.
that's how I
and
was.
you take it.
That is
Yeah,
it.
maybe I was also like that and I took it. So people who take this substance, don't just take it for granted that they chose to. No, it was not their choice. And that's why they need to be helped. So people have pain, emotional pain. And remember, we are saying these substances are addictive. You can't live without support, without help. But the good thing is there is help.
Okay, thank you very much. There is this thing that people normally think that, for example, Joyce, if I share with you my problem, or if anything is bothering me, stressing me, and I share with it, means I'm weak. So
Yeah.
people tend to keep their stress in fear that if I share with someone, they think I'm the weak person. I cannot handle issues, maybe, and this has kept people stressed and resort to abusing substances, just short-term solutions for a long-term problem. Share with us, why do these people go ahead and abuse these substances as well?
You know, with adolescents, they have those peer groups. They have their age mates. When they come together and they find they have the same problem, then they will share that, I also was in that kind of situation and I used this. Unfortunately, some of these substances are being packed in a way which is so, you feel good, you feel something inside is good. So they share. You had that problem, me, I used this. And the person they are giving is not even aware that what they are giving, that him or her, is a substance.
Okay.
So they go in innocently to take and to use. And after using it, they will feel good, as we've said. But then, in the end, they find themselves being captured in that kind of way.
Indeed, they
addicted,
find
yes.
themselves captured.
And just to add on, I think, you know, we need to be aware, we need to warn our young people there that some people are making money out of this. It's a
Yes,
business to them.
yes.
That is it.
So they are not doing it because it was good for them. They are also doing it because they are earning money.
Earning.
So they are giving you this substance. Put in your tea. You
It
will
will-
keep awake. You'll be able to read.
Yes.
But for him or her, she's earning money.
Yes.
And yet you are getting a disease.
Yes.
That
And
is
we are
it.
saying addiction is a disease. But we shouldn't forget that it is treatable.
Yes.
Yeah.
Okay, thank you very much. Now that brings me to the effects of substance abuse. Like they would say that these people innocently, they're looking for short-term solutions. You have this and you know, and once you take it, you feel fine, by the way, and like, wow, I think this is the way to go. But you're creating more challenges, more problems. Now, those are the ones that I want us to explore. Share with us some of the core challenges, the effects that can come with substance abuse.
Like I said earlier, these substances are affecting the brain. They're affecting the brain chemicals. You know, we were created to have chemicals balanced.
Yes.
You will feel happy when you have something which makes you happy. You are sad when there's something that makes you sad. But then you don't remain in that sadness. So chemicals in the brain are well regulated. So the way we think, the way we feel, affects the way we behave.
Yes.
Yeah? So when this chemical is in the brain's imbalanced, yeah, we can do things which we never expected to do.
That is it.
Yeah? So the effects, they are risky behaviors that young people get involved in. Yeah? We have HIV AIDS.
Yes.
But substance abuse has been associated with increased rates of HIV.
It's
Yes.
Yeah? Because when we take these substances, we are not thinking, we are not making the
Right decisions.
right decisions. We are not judging situations. So we are having problems with which come
Judgment.
as a result of our risky behaviors. Exposure to HIV AIDS, exposure to road traffic accidents,
Yes, you're
yeah?
right. Yeah.
Even suicide, you know, even
Yes.
our own health, we the people abusing drugs. When you are not thinking well and reasoning well, your work is affected. Yeah? For example,
Yeah.
if you are a student, you might think you are happy, but you are not reading, you are not concentrating. And if you are not concentrating, you forget. Yeah? And it means that there is going to be that academic decline. Even when you are working, like you are a husband or a wife, your work from the home chores is affected. You can't work as you used to work. But also, if you are employing people, your behavior can affect other people, can affect your family members, right from the children. If you are the father, you can imagine, if you are the father looking after children, and you are using substances, yeah, maybe alcohol, and you are addicted to it, it means that all your resources, the money you get, that greatest challenge, there are these social impacts and financial constraints. Because the money you are getting, you have to think about getting the substance, yeah,
Before anything
before
else.
you give it priority. Yeah, and your children do not come as number one. Your wife does not come as number one. But also your behavior, the behaviors of people. Some people can become aggressive.
Yes.
Yeah, and this affects the family. It affects everybody. If it's a young person, you can imagine you are not working, but you are addicted to this substance. So they start by stealing. They use all their resources.
You're right.
Maybe you have given school fees, you are given school fees for studying, you first finish that school fees. Then you start stealing from your siblings, yeah? Then from your parents. Then when the resources are finished, you go to the neighbors.
Yes.
You start stealing the window, driving,
Those
Mirrors.
mirrors, what you
indicators.
sell.
Don't
So you
see.
get this, you sell the phones to get that money so you can buy the drug. So there are so many effects which affect the person, but also the family where that person, is coming from, and the society, So it is a very difficult problem, As you see, the time when they need treatment, they have lost the social contacts. People are like, we have given up for that person.
Okay.
Yeah.
Thank you very much. You've made me remember of a story. People who abuse drugs, by the way, they never lack money to buy these things. If it's a husband, the family may be starving, the kids don't have school fees or what, but for him, he always gets... Yes, I don't know how they get to this level. Rebecca, you're going to also share us briefly on the effects.
I would mention that if your mother is pregnant and happens to abuse drugs, it will affect the unborn. The unfortunate bit is that research was done and the unborn baby is affected because of these drugs. So it is important we talk about it now because it's not good.
Okay, thank you very much. I think we need to educate our people in case you're in the sitting room and if you're a parent, you have children in school or where, you need to know that this is a very big problem. Like David have said that the challenges or the effects are very, very many. We need to work together. We need to work as a team, as a family. We have to put a program, and even as a community, we need to really do something about substance abuse. Now, we're going to go on prevention as we come towards the end. Prevention, how can we, because I see the problem are quite too many, and the effects are really very many. How should we prevent this? What strategies can we put in place to ensure that our youth, even the old people, by the way, yes, what measures can we put in place? Share with us.
For prevention, we need to be aware. Like now, we are trying to create awareness. When people get to know that there is a problem, and it's not, you know what happens, many people, when we see people using substances, we tend to think that maybe they came from the sky, or they came from where. We need to know that these people come from families.
Yes.
Children were born, as Sister Rebecca said. If children are exposed to alcohol, for example, when they are in the mother's womb, this can affect them there, but also their future use of alcohol. Because exposure to this alcohol at any stage, it affects the problems later in life. People who have alcohol addiction, who are addicted to these substances, many of them started using them before age 14 years.
Wow.
So we need to know that. So in terms of prevention, we need to know that it is a big problem. It is a huge public health problem.
Yes.
Number 2, we need to talk about parenting.
Yes.
Parents, my dear parents, it is not easy, but we need to be there for our children. We need to have this friendship with our children. Right from the beginning, we are playing with them, we are eating with them, we are discussing with them, so that when they get challenges, they can get the energy to discuss with us what they are going through. We need to put some controls. You know, parenting is not very easy. But I am going to give you 2 parents examples. One parent does not matter, does not care what time the children come home, what they are doing, I don't want to know. Their friends, I don't want to know. I'm not bothered. Especially when they are getting older. He's an adult, he's an adolescent. 15 years, 13 years, they will come back. Then there's this other parent who is like, now we have to sit together, we have to develop a program. We have like family rules. We try our best. I can't say that we can exhaust it, but we try to put boundaries for children. Then we shall be able to know that Joyce has not been behaving like this. What is happening? So we need to set boundaries as parents, but most importantly, to bring our children closer. And when, prevention is at many levels.
Yes.
That is before they start. But even when we know that they have started, we can prevent the problem from getting worse. We still need to be there for our children, even when we know that they have started using these substances. Like I said earlier, some children are going to start using these substances because of so many reasons. They have been failing at university, they have been failing, they have been abused sexually, they have been abused emotionally, they are depressed, they have reasons why they are taking these substances.
Indeed.
So if you are distant from your children, you are not going to give them the support. So prevention is at many levels. We can prevent the adolescents, the young people from taking the substances, but also we can prevent the problem getting worse, by identifying the problem early and seek treatment.
Okay, thank you very much. I think this is it's really a big problem, by the way. I don't know whether in your sitting room you're recognizing how big this problem is. Now, as parents, really, I don't know, how can we notice, how can we know? Because like you said, doctor, it's good to know in the early stages, so that I can be able to take the necessary steps in order to correct the anomaly. Now, how can I be able to know that this child of mine, I think, is starting to abuse the drugs? How can we help the parents? Any view on that?
I think Doctor said it well, that we need to build a rapport with our children
Yes.
as early as possible. We need to know what kind of friends our children are having. We need to know, to put the boundaries. Because most of these children, if they are not abusing the drugs early adolescent life, when they're in college, school, they have peer, they have friends. So when you've been having your children, you have family meetings, you discuss issues, they have their brothers and sisters, even going to their bedrooms. Some parents find it hard.
Yes.
They don't check what their children are, how their bedrooms are, what they are keeping in their bedrooms. They do. We thank God for COVID, because now we have some time to be at home with our children and get to know what are they doing, what are their friends like. I think we have to use that time.
Indeed.
If you've been following your children, you will see those
can see
funny
the
behavior of
differences.
your child if you are keen and you've been doing it.
Okay, in other words, as parents, please, if you see any difference, slight change in behavior, it's not
Even
by chance.
grades,
Yes.
when they are
Even
performing in
grades,
school, they will start performing badly.
Always
Maths,
inquire.
that is it.
Try to find out why. What
And
could be the
another
problem?
thing I wanted to say, parents, we should not really, should I call it compromise? I don't know. Some parents don't want to say the reality to their children.
Yes.
If a child is in wrong, they fear to tell the child that this is not good. But I think you tell it in a good way, but then be there for support.
Okay, thank you very much.
But I think also, because parents might think we are really judging them.
No.
Yes.
It is a role. But also the young people. I know that, like I said earlier, there are reasons why we are choosing to go into drugs.
Yes.
Please feel free to share with your parents, with your family members, with your friends, that this is what I'm going through before it gets worse. Yeah? Let us choose. Sometimes we are overwhelmed. Yeah? But let us share. When you share your problems, and also we need to know that not everybody who will change behavior, not everybody who will be like feeling sad or whatever, people wanting to be lonely, they are not abusing substances. They could be having other problems. So what we are saying is that parents, please listen, be there, not just to talk, but to listen to your children.
Okay, thank you very much. We are concluding, and we've entered into the very last part. That is the help. How we can help them. I know we've talked about the parents and what. Medically, do we have any solutions for them? Do we have any way out of this saga?
Yeah. So we are saying that this is a problem. It is a huge problem. It's a huge public health problem. And when we talk about health problems, there are treatments for them. I talked about these substances affecting the brain. In some cases, we need the talk treatments. We listen to them. We find where the problem is, and then we know what to do. But the challenge is the stigma.
Yes.
The people who are using these substances are stigmatizing themselves.
Yes.
They have gone so far, they believe no one can believe me, no one can trust me, no one can love me. Yeah? The stigma problem. Even when it comes to hospital, people have stigmatized hospitals. The people don't want to go to Butabika Hospital.
Yes, they know.
Yeah? But we have professionals, very
Yes.
good service there.
Very good, yeah.
But people don't want to go there, and yet they have the problem. So my call to the community, my people there, please feel free to go to hospital, not only Butabika, Mulago, and also the health facilities near your families where you are coming
Thank
from.
you very much. Your parting shots. How can we help these people in 30 seconds?
Those who are intending to be pregnant and they know they are abusing alcohol, let them stop so that they don't pass it over to the unborn babies. Just requesting mothers, if you intend to become pregnant, stop using
And
the
people
alcohol.
don't know that wine also has alcohol.
That is
Yes.
it.
So they say, don't
It-
take alcohol,
it
just
does.
take a little bit of wine.
That is it. We are saying if we are to prevent this from our children, we should stop before we bring these children into the world.
Okay.
So we are saying they should not take it.
Okay, thank you very much. We've come to the end of our program. It's been really very exciting. I wish we had 1 more hour, but we don't have any single minute, but we are ending from here. Thank you for attending. We've learned a lot about substance abuse, the causes, the effects, and how we can help people. There is medication. In case of anything, please go to the nearest medical facility. You will be helped. And as parents, let us try to be close to our children, know what's
And
wrong
not
with them.
judge them.
And don't judge them. Like the way the doctor said, there are reasons as to why they went that way. Listen to them, understand them.